Hi, I'm Olivia, and I'm a junior at Watkinson School, which is in Hartford, Connecticut. And Dr. Webb Hooper, I did some research about your background, and I noticed that you have multiple degrees in psychology. So I was wondering, how has that helped you in your work as the Deputy Director of the National Institute on Minority Health and Health Disparities?
That is an important question. I think, I am a clinical health psychologist, and one way I think that helps me in my career now at NIMHD and at NIH is because I have a very holistic way of thinking about health. I think about health as being related to a whole person. I don't think necessarily as, simply as people as a set of molecules or a set of diseases, but I think about people holistically, thinking about that health does not occur in a vacuum. We are in many ways a product of our environment. And so as it relates to health, I think the opportunities for health are not equally distributed, but thinking about things from a lens that is beyond the general biomedical model to consider how psychological and mental health affect illness and affect disease processes and affect one's opportunity for wellness are very important. The other thing that I've focused on in my career that I think is highly relevant to my work at NIH is I focus on health behavior change. And we know that health behaviors are very much tied to the development of a number of chronic illnesses. So behaviors such as engagement in physical activity, engagement in not smoking, for example, alcohol use, sexual behavior, all of those are health behaviors. And even now what we're dealing with COVID-19, the way that we can protect ourselves in the absence of a vaccine, even with a vaccine, is by behavior change. And many of the behaviors that are associated with chronic illnesses are those that, those illnesses disproportionately affect racial and ethnic minority and other underserved communities. And so I think as a psychologist, I'm able to offer a perspective that is complementary to what physicians can offer, and that allows us to advance the science by thinking about the whole person and those upstream determinants of health that are beyond the individual level.